Welcome to Serving Locally with me, your host, mrs.deines, a podcast where we spotlight service in the Longmont and surrounding communities. All right, let's connect. Hi, and welcome to today's podcast. We are here with Ashley.kasprzak with the UCHealth Longs Peak Hospital Foundation, and I have been so honored to help do some fundraising with this organization. We did the Topgolf thing for scholarships for healthcare workers.
Exactly.
And we were also able to do a women's health documentary about endometriosis at the Longmont Museum,
Yes.
Hospital, Longmont Museum. And that was awesome because I apparently needed that, and I get to go see the doctor that was on the panel this coming Friday to help me out. So.
That particular public education program was amazing. We didn't host it, but we helped sponsor it. A company in Longmont called Align PT decided that it was such a pressing issue in our community that they wanted to raise awareness and bring the documentary to the Longmont Museum. It was amazing. There were over 100 people there to learn about women's health, and particularly endometriosis. I hope your appointment goes well and challenges are resolved.
I am excited about it because it has been a lifelong, ever since I was 13. It's been a struggle for me. So I am so blessed that just by getting started with doing this, that I was able to connect with you and you were able to connect me with that. And that is already making an impact on my life. So I truly thank you for just doing that for me.
And remind me of the doctor you're going to see.
Dr. Brian Nelson.
Yes. When he spoke and his team of nurse practitioners, they were amazing in their expertise and how much they know about the disease. And I learned a lot too.
Yeah, it was awesome. So we'll jump into this episode. So just let us know who you are and what is the UCHealth Longs Peak Hospital Foundation, and just a quick overview, and then we'll get into the background.
Thank you. I'm glad to be here. So I have been in healthcare philanthropy for almost 10 years. And early in my career, when I worked with nonprofit organizations, I wasn't sure about healthcare philanthropy because I thought, well, the hospitals are so big, and why would they need donations from our community members? And the older I got, the more I realized how important it is to have excellent healthcare for everyone and in our communities, not just the big city of Denver, Aurora, and that healthcare philanthropy can really help individuals who lack access, who are in financial crisis, healthcare workers. It's just tremendous because in our case, UC Health covers 100% of the administrative costs. So when a donor makes a contribution, all of it goes to the cause that she or he want to support. It's awesome. It really is. And I did benefit personally from some healthcare philanthropy. My sons had speech challenges, and so that would have been 20 years ago. We were able to have speech therapy through the school district, but they both needed a little more. My youngest son was in the 9th percentile for articulation and motor planning, so he qualified through the county to receive speech therapy in our home. His older brother wasn't quite as challenged with his speech, and so he didn't qualify for that type of support. Fortunately, in Loveland, there was the McKee Medical Center Foundation, and they underwrote the speech therapy for him, made a huge difference in our lives. That early intervention can help children just be integrated with other kids and find success, gain their confidence. So it was really cool. When Jared then was 6, he was asked to fire the starting flare for the Loveland Turkey Trot that
Oh,
raised
good.
money for speech therapy.
Oh, good.
Then when he was 16, that turkey trot happened to be on his 16th birthday. So I had a special balloon turkey feather thing made for him, and he wore that the entire 3.2-mile run.
Wow, that's
It
awesome.
was really cool. So speech therapy made a big difference in their lives. They're both successful young men, and I ended up joining that hospital foundation that helped our family. It was my first job in healthcare philanthropy. Then, nearly 6 years ago, UCHealth was opening a hospital in Longmont.
Mhm.
They collaborated with Longmont Clinic, and UCHealth decided to invest in Longmont Frederick Firestone by adding a hospital. We started with a 24-hour pharmacy, 24-hour emergency department, inpatient, and quickly started adding things like lymphedema therapy. When cancer patients, or sometimes people just have a lymphatic problem, we added a clinic. The foundation and charitable dollars help pay for the equipment, the special training, and individuals dealing with that challenge can benefit from a garment. And so we cover the cost of the garments. And to see how that particular program has benefited adults' lives, it's just been tremendous.
That is so great. Yeah, we've had to use the emergency room there. It's just down the street from our house, so it's that emergency room is amazing. The care that they give firsthand, I know for sure.
Good. Thank you.
Can you give us a little background about the organization?
So UC Health Longs Peak Hospital Foundation has grown to have 17 designated funds, and that means we're able to support particular programs or innovative efforts. We have our emergency department and fund. We have intensive care unit. During COVID, that was really important, and our donors helped purchase more ventilators. It wasn't widely known, but many of the colleges, universities, veterinary schools loaned ventilators to hospitals because there weren't enough ready for COVID. So we were able to help purchase 2 ventilators and warmers. We also helped with infection prevention to get rid of the fabric curtains that were in individual rooms. It was really imperative to be able to wipe everything down, sanitize. So ICU is another one. Third fund that we have, as you mentioned earlier, is scholarships for our employees. We want to make sure they're as well educated as possible so that they're delivering excellent bedside care or providing excellent social work, guidance, even financial management, clinic management. There are so many particular jobs in healthcare, and we want to help employees grow in their careers and do the best they can. We believe that benefits you, me, our whole community.
Absolutely. That continuing education for everybody is key.
Then that complements some education UC Health provides, but ours helps employees do even more. We have funds for education and community. It's called Healthy Hearts and Minds. And we have nurse educators go into schools, and they'll reach over 6,000 students in the St. Vrain Valley School District this year.
Wow.
So primarily in February when they're encouraging movement and heart health. And I'm so excited about that program because in our communities and world, many people talk about prevention, but there aren't dollars for it as much. And so when we can invest dollars in helping students take charge of their health, take ownership for what they eat, how they exercise, if they're engaging in smoking or vaping. I think it's better for the individual, but our entire community.
Absolutely.
I could just go on and on, Michelle. I'm trying to think of additional programs. The newest one that we're most excited about is oncology. We've added 2 funds, one for cancer care and innovation, and one for cancer patient and family assistance. And so we are doing an event coming up about that and fundraising for that event.
Yeah, we'll talk about that one a little later. I'm excited about that one. Tell me about the mission of Longs Peak Hospital Foundation.
Our mission is to advance philanthropic innovation to support healthy and extraordinary lives. And the reason that we're so focusing on philanthropy and innovation is UCHealth is an innovative healthcare provider. At the same time, dollars are not limitless. We're having decreased reimbursements for services for patients who have insurance through Medicare and Medicaid. Everyone knows through COVID, supply costs have increased. The cost of personnel, hiring our nurses, has increased. And when philanthropic dollars can help support, we can do even more. So we're interested in talking to individuals, talking to businesses and corporations about what their interests are and where we can meet to provide even greater things in our community. So that's what our mission is, and we're excited to fulfill it.
So who are you trying to reach with your organization?
We are trying to reach individuals who care about healthcare, who care about community health, who care about our healthcare workers, and also those who can benefit from what we do, which would be the entire community, because all of us have a health challenge at one time in our lives or another. The UCHealth logo, and you can see at our building at 1750 East Ken Pratt, the entrance has an archway, and it really symbolizes how we're caring for individuals from birth through end of life, the entire spectrum. So our stakeholder groups are many, but primarily we're trying to reach donors who want to improve health, benefit their loved ones and their neighbors in ways that they couldn't on their own. I believe that our hospital foundation connects people who have an interest and passion to a cause that they couldn't just help on their own. It's because of health privacy and awkwardness, quite frankly.
It's taboo. You don't talk about it.
Yeah, and no one's going to just walk into the lobby and look around and say, who can I help today?
Yeah.
We're a conduit to help improve lives, and really by focusing on health.
Yeah, that's awesome.
Thank you for caring. I know you have had health challenges. You've shared some here, and you know that education and good healthcare improves lives. It really, really does. So thank you for what you're doing to help raise awareness.
Thank you. I appreciate that. Yeah. I want to help be a conduit and connect people so they know more about you guys and so they can help in that way. So that's great.
Yeah, Michelle, when we first met, I thought we're fast friends because we have similar values and interests. And so I'm just so impressed with everything you're doing.
Thank you so much. And that's one surprise that I've had with this journey, with being Mrs. Longmont and what I want to do here is that I was not expecting to make friends with the people that I was just like, oh, we're just gonna be like business partners or something. But I have made some really good friends with my sponsors and my serving partners. And like, I want to keep going because it's just like, oh, there's just so many people out there that have the same heart and that needs to be, shown in the community for sure.
And it's about, I think, going through life with integrity and being genuine. And I feel that from you so much.
Thank you.
We're fortunate to know each other.
I love you, Ashley. Okay. What makes the work of UC Health Longs Peak Hospital Foundation different than other similar serving organizations?
I've thought about this question a lot because we have excellent health care in Longmont, provided by Longmont United Hospital. Of course, with UC Health and Longs Peak Hospital. And I think that we are differentiated because we're connected to University of Colorado Hospital and University of Colorado School of Medicine. It's pretty incredible to be connected to an academic institution that is on the cusp of innovation and discovery and research, and that we can bring that to Longmont and be connected is powerful.
Absolutely. No, I completely 100% agree. Yeah.
I think that UC Health Longs Peak Hospital is unique in that we're connected to University of Colorado Hospital in Aurora and the School of Medicine. It's tremendous to be connected to an academic institution that is innovating and researching and bringing that to us in a powerful way. You don't have to go to the Mayo Clinic necessarily. You can receive top-notch care here in Longmont. And if you need to go to University Hospital in Aurora, all of the records are attached. The doctors talk regularly and makes it easier for patients. There's an individual who's going through cancer treatment right now who lives in Netherlands, doesn't like going to University Hospital because of the traffic and the parking. And he goes there occasionally, but more often he comes to Longmont for Longs Peak Hospital. He can be seen by Rocky Mountain Cancer Centers, University of Colorado radiology specialists, and Longs Peak Medical Center care providers. They all collaborate and network, and it's a unique situation.
Yeah, and that's great too. I've with my son having issues and stuff too, like being able to that they all work together is awesome because otherwise they don't. You're like, oh well, I got to call this place and get it transferred over, and it just sucks. But
Navigating is tough.
yeah, it is.
It really is.
What are some of your favorite stories of helping patients in need through the Foundation's Patient Assistance Program?
When you ask that question, the first thing that comes into my mind is a really unusual story. It's something I'll never forget. There was a gentleman about my age who was at the end of life. He had cancer, and he had 2 high school students at home. He and his wife were just shocked that this happened to their family, that he was going to pass away, and he did not want to be in the hospital for that. They could not afford a hospital bed at home, so our foundation paid for one. They didn't have a truck. They didn't have any way to get it there. And so I said, I'll take the bed. I'll pick up the bed. I'll deliver the bed, which was great. My husband was a little unhappy because I scratched his radio screen on the dashboard, but I got the hospital bed to this family's home. And the young boy and his sister, they were not in school because their life was about to change dramatically. And the boy had one of those panda bear heads on. And so we're talking, and I'm trying to get the bed together and couldn't fit it all together. I had no idea really what I was doing. And he and his sister said, they just jumped in. They're like, we're going to help you figure this out. So all of a sudden, this boy with the big panda head was laying on the carpet in between their kitchen area and their living room. And he was holding the metal bars. He still had the panda head on. And he's looking at me. And his sister's holding it. And I'm holding it. And then we got it all together.
Oh.
And we tested the controls. The only way the doctor was going to let this man go home was if there could be the back that lifted and him up to eat and better swallow. And at that moment, it's like time froze. And I looked at these kids and I thought, this is not a huge deal, bringing this bed, but it's one little thing that's making their life better. And that was quite powerful. We have delivered ramps so patients who are in wheelchairs can get home if they have the steps. Technically, they can't be discharged unless they're going to a safe environment. So we've really helped in those cases. I'll leave you with one more where a gentleman lived with his wife and 3 kids in an apartment. He's a construction worker and main provider for the family. He had a terrible virus and he needed IV antibiotics. They wanted to give them to him at the hospital every day for 2 weeks, but he was going to lose his job. And one of the nurses and doctors said, well, he could have this at home, but insurance won't pay. So we paid approximately $1,500 for a nurse to go to his home at night to make sure he had the IV antibiotics. And he was able to keep his job and get better. And it kept the family whole and kept them under their roof.
Right.
So we truly made a difference in that family's life.
That's incredible.
It was amazing.
See, the more I learn about these organizations, the more my heart is just like, oh, people need to know this, you know, it needs to get out there more because it just, in the community to help individuals, that's where it starts. It's that ripple effect.
Yeah.
So
I agree. And we couldn't do those awesome works for patients in need unless we have the donors, the supporters.
Absolutely.
They're key.
What types of activities does the Longs Peak Hospital Foundation support?
We support activities within the hospital and UCHealth activities in community that are benefiting students and patients. So, for example, I never knew that talking about balance and core strength equates to fall prevention. And when you prevent a fall, you're preventing a trauma.
Absolutely.
So we have a trauma services fund, which helps provide classes on fall prevention and balance. And I've become really good friends with Val Peasley, who leads that program. Movement is key to staying healthy. Many older adults don't move as much during the winter because they're afraid of falling. Everyone wants to avoid an ice slip and breaking a joint because sometimes people go way downhill after that. So our last fall prevention classes included those yak tracks that go on the bottom of tennis shoes.
Oh.
So they help individuals if they're outdoor walking in winter conditions. And that's one example of a way that we're benefiting the community.
This next question I'm super excited for, and I've been looking forward to it ever since I think we talked in, was it August?
Do you remember I read about you in the Longmont magazine?
Yes.
And I was at a coffee shop, my favorite coffee shop, which is Red Frog. And I thought, this woman's pretty neat. I'm going to call her. And then we started talking about the clay shoot, which is our next fundraising event. It's on April 22nd, and it will benefit our oncology program. 50% will go towards integrative medicine and adding components of integrated medicine to benefit patients. And 50% will go to patients and families in need for gas cards, for electric bill, car repair, really basic things that help them keep being a contributing member of society.
Yeah. I'm real excited, and I will have all the information to sign up for the clay shoot, which is coming up real quick, I know. But we're real excited to be a part of this event. We've had a lot of cancer in our family and the extended family, so that's how we connected the most on that. Is just that's our hearts are there for those people.
Can you remember, did any of your family members benefit from integrative medicine? And I've learned it really includes like dietary guidance, massage,
Not much, no.
acupuncture. One of the things that can be so debilitating is the treatment because it's killing the cancer, but also can affect other parts of the body. So we're really trying to raise enough money to add an acupuncture treatment room. That can help when an individual has so much nausea from the treatment and they can't eat. And if you're losing so much weight, then you're weak, and that's a downward spiral. So we want to help make sure people feel good enough that they can swallow and eat.
It's a whole body treatment, not just this group or whatever of cells. It's and I think that is invaluable in looking at it because it affects your entire body down to your mitochondria. So yeah, to support all of those functions is great that you guys look at all of that to help the
It really is mind and body. And
Mind,
for
body,
so
yes.
long, Western medicine is only focused on the body and how are we going to
Symptoms.
kill these cells.
Yeah.
But if we can add more instruction about mindfulness and healthy nutrition, it's going to benefit the individual and help them, in many cases, live with it. So many more people are living with cancer than previously. It is expected that nearly 2 million people will receive a new cancer diagnosis this year alone. And having just excellent care locally is a gift and a benefit for all of us.
Absolutely. Do you have other events or volunteer opportunities coming up?
In October, we're going to have a cornhole tournament. Cornhole is a growing sport, and we have had 3 cornhole events. We're going to have a 4th one, as I said, in October, and it will be at Left Hand Brewery. They have a new event area and a wonderful grassy space, courtyard, and so we're excited to be there. We do have opportunities for video editing, video creation, capturing patient stories, and I have had high school volunteers before, and something that is incredibly challenging for me, they are wizards at editing and making snippets that we can share on social media. So that's our biggest volunteer need right now.
Same. Yeah. The editing is like this horrible monster. So what are your greatest needs right now?
Our greatest needs are support for cancer care. We are concerned about the level of reimbursement we're getting, as I said, from Medicaid, Medicare. UCHealth is the greatest provider of care for Medicaid patients across the state, and we provide over $200 million in uncompensated care and community benefit. We can't keep doing that unless we really increase our philanthropic support. And we want to grow the cancer care program, and we need more space. We're excited to offer the opportunity to name spaces, and I'm looking forward to connecting with an individual or a family that would like to name the acupuncture space, that would like to name the lobby where patients exit when they're done with treatment and they ding a gong and they can feel like, wow, we've achieved this. We can go to the next stage of our journey. We can name the Longs Peak Medical Center lobby. So there are incredible opportunities for honoring your family and leaving a legacy. Those opportunities are really between $25,000 and $1 million. So it's not something that's just done quickly. It just includes a lot of discussion and discovery, and I'm happy to do that with donors and looking forward to it in the future.
How would people get involved in any events that support the UCHealth and Rocky Mountain Cancer Care programs?
They can contact me. I'd love to have an email exchange or go out for coffee or lunch. I love brainstorming. One activity I did not mention that volunteers make a tremendous difference with is making quilts. In our intensive care unit, the palliative care nurse, Nina Barrett, has done an amazing job of making the last days of an individual's life as personal and touching as possible. So we have tried to give a handmade quilt to every patient in intensive care who is either in his or her final days or is going home with hospice care. And I just had the opportunity and felt like it was a very graceful situation to visit a family's home who just lost their patriarch, and there was a quilt draped on the back of the couch, and I thought, oh, I hope that was from us, and it was. It was from a volunteer, one of the Central Presbyterian church women who made this gorgeous quilt, and it's one of the last things that gentleman touched, and his wife cherishes that item. So people can even volunteer from their homes like that. Just has to be pet-free, smoke-free, and the quilts are then given directly to families, patients in need. That's one way. Another way is to do the video editing like we talked about. And another way is to help us connect with donors. There's a gentleman in town who is new to the nonprofit world. He'd like to gain more experience, and he's helping me collect prizes and live auction items for the clay shoot.
Awesome.
So he's out and about meeting business owners. And I like to be creative and listen to what individuals need so it can benefit them too. So there are many opportunities. The sky's the limit to volunteer with us.
How can people contact and find out more about Longs Peak Hospital Foundation?
Our website is a great place. We have our impact reports there. We have sponsorship opportunity brochures. We have an active presence on Facebook, Longs Peak Hospital Foundation there. Or email me. I'm really approachable. Ashley.kasprzak at UCHealth.org. And people may be thinking, well, I have no idea how I would spell that. So it's Kasprzak. And Ashley is traditional, ASHLEY.Kasprzak at UCHealth.org. And our phone number is 720-718-3015.
And I'll have all that information in the show notes. You can also go to my QR code. They're on there also under serving partnerships at the UC Health tab on my link tree also.
Thank you, Michelle.
Yeah, absolutely. Yeah, is there anything else you'd like to add that you feel like I've missed asking or that you just want to talk about for a minute?
As we've talked, I've reflected and thought that I've addressed many different areas of health, and in a way, I felt like I was all over the place. But that's because we do so much. You know, like I said, we can do this trauma prevention. We are helping patients in the intensive care unit. We're helping cancer patients. We're educating and lifting up students so they know they can make a difference in their health outcomes. There are just so many ways that we can connect individuals who care about health with a cause they're interested in through UC Health. So please do contact me, reach out to me if you're interested, and we'll talk and we'll dream and brainstorm together.
Well, you say you're all over the place. Well, from birth to end of life is everything in between. So it is, but it's not. It's just life, and that's life for everybody. So
well said.
Yeah, so I appreciate everything that you do in the community, and I look forward to doing more with you in the future. And I am just blessed to know you as a person and have your support in what we're doing here. And I just want to thank you for coming on the show today.
You're welcome, and thank you.
Thank you.
Michelle, you're blossoming through being Mrs. Longmont, and I know you're thinking about doing it again, but I encourage you to do so.
Thank you very much. Thank you to my guests, my listeners, and my supporters. Serving together, we can strengthen our community. Please like and subscribe. Do all those other things. You know you got to do them. Because that's the easiest way that you can serve right now. All right, now go. Connect with others and be a blessing.